One condition that I might see in my nursing profession that affects the digestive system is GERD. So GERD stands for gastroesophageal reflux disease, which is when the lower esophageal sphincter relaxes at the wrong time, which allows stomach acid to enter back up into the esophagus. So the main symptom that somebody might experience if they have GERD is heartburn or acid indigestion. So some ways to combat this is by eating smaller portions. If the patient is overweight, losing weight, not eating foods that trigger acid reflux, and possibly getting prescribed H2 blockers to help. Another condition that I might see in my nursing profession that affects the digestive system is celiac disease. So celiac disease is not the same thing as gluten intolerance. Gluten intolerance is just when the body doesn't like when you eat gluten, so you might have diarrhea or bloating, something like that, but you still can. But with celiac disease is an autoimmune disorder where a person's body begins attacking their small intestine if they eat something that contains gluten, so anything with wheat, barley, or rye. And if someone continues eating gluten and they have celiac disease, their small intestine could get inflamed, which can cause for malabsorption. So one way to treat having celiac disease is just completely avoiding all gluten. Another condition that I might see in my nursing career is diverticulitis. So diverticulitis is inflammation of the intestines, mainly affecting the haustra of the large intestine. So diverticulitis happens when, say that somebody has a tear in their large intestine, so inflammation starts occurring. So some symptoms of this could be abdominal pain, fever, constipation. And the way that they diagnose this is by doing any other tests to rule out all other possibilities. So they'll do like a pregnancy test, they'll take a stool sample, blood and urine test. And so to treat this, if the case isn't too complicated, they'll just put you on a liquid diet for a few days and give you antibiotics. But if it is complicated, then you'll have to have surgery in order to fix it. Another condition that I might see in my nursing profession is Crohn's disease. So Crohn's disease is inflammation of the bowel tissue, and it can start affecting deeper parts of that tissue. So we're not completely sure what causes Crohn's disease, but some possible ideas is that it's hereditary or that a virus or bacteria triggers an immune response, so the body starts attacking that microorganism, but in the process it then starts attacking its own cells. So some ways to treat this is by giving them anti-inflammatory drugs, antibiotics, immunosuppressants, and in some cases you might have to cut out the diseased portion of that digestive tract and reattach it to a healthy portion. But unfortunately, Crohn's disease itself isn't curable, and in some cases it can be really debilitating and life-threatening to some patients. Another condition I might see in my nursing profession is a peptic ulcer. So a peptic ulcer is a sore that develops in the lining of the small intestine, stomach, or esophagus, and this is caused because of inflammation from a certain strain of bacteria or from stomach erosion from acids. So the main symptom of this is abdominal pain and weight loss. So one way to treat this is by prescribing the patient a proton pump inhibitor, which will greatly reduce the amount of acid in the person's stomach, which will stop the erosion.